Hello and welcome back sa Maikling Kwentuhan with Doc Athena. So ngayong araw ay pag-uusapan po natin problema sa mata. I am talking about keratoconjunctivitis. So this is more commonly called as pink eye. So keratoconjunctivitis is the inflammation po of the cornea and conjunctiva of the eyes. So pag sinabi natin na inflammation, there are 5 cardinal signs of inflammation when it comes to pathology or in the medical community. So isa nga dito, yung madalas nating makita sa pink eye, which is the rubor or the redness. Other signs would include tumor or swelling, pain or dolor, and also calor or yung heat. So, mapapansin nyo, minsan hinahawakan, mainit, no? So, yun yung calor, which is yung heat. And also, yung loss of function or function lisa, kung tawagin. So, isa nga doon, no? Yung reddening or rubor. At actually, yung nakikita natin na pink eye is actually a mild form pa lang of the reddening kasi eventually magiging red yon. Okay? Kung talagang may inflammation siya. So, yung mata, no, ng ating hayop na yung goat or it could be sheep or cattle, no, merong reddening kasi nga may inflammation. Eventually, that might lead, no, to corneal opacity or minsan sinasabi nila na cloudy. So, nawawala yung red, nagiging white na. Bakit kaya? Yon ay magiging eventually ulcer. So, pag may ulcer na siya, masakit na yan. Ulceration na yon that will eventually lead to temporary blindness or unfortunately minsan nagiging permanent blindness po siya. Ganon yung pink eye na nakikita lang natin is akala natin pink but actually mild form lang yon ng reddening or yung rubor as part of the inflammation or yung keratoconjunctivitis nga na sinasabi natin. So, given na meron kang keratoconjunctivitis, agad-agad ba magbibigay ng antibiotic? No. So, bago magbigay ng antibiotic tulad ng ibang mga sakit, dapat alamin mo muna ano ba yung naging sanhi na pinoproblema mong sakit. So kung yan ay pink eye, alamin natin ano ba yung naging sanhi ng pink eye sa inyong alaga. Paano nagkaroon ng keratoconjunctivitis? So merong mga iba't-ibang sanhi ang KCS or keratoconjunctivitis or pink eye. We have the non-infectious causes, we have neurological causes, we have anatomical causes, and of course, yung infectious causes. Ayan, simulan natin sa non-infectious. So, yung mga non-infectious, usually yung allergy, trauma, injury. Sa allergy, ano yung mga nag-cause ng allergy that could lead to keratoconjunctivitis? So, it could be hay or other grasses na pwedeng allergic yung animal nyo doon. Or it could be dust. Baka naman kasi napaka-alikabok doon sa lugar nila. Or baka meron kang ongoing construction. Pwedeng may irritant doon sa air or kung ano man yung ginagawa dun sa place or sa housing mo. Or baka naman kasi may nag-spray dyan ng mangga, may manggahan ka, nag-spray ka, pwedeng maging irritant yun sa ating mga alaga. What else? Trauma or injury. Tingnan mo din, yung housing. Baka naman kasi dun sa kulungan nila, may mga nakausli pala na pako. Baka gumamit ka kasi ng bamboo or cycle materials like wood. Baka may mga splinters dun na maaari mairita dun sa mata ng ating alaga kaya siya nagkaroon ng pink eye. So these are the common non-infectious causes of pink eye. Doon naman tayo sa neurological or involved na dito ang central nervous system. Dito kasi, titingnan mo ano yung mga differential diagnosis mo or what could be the other possible causes of blindness. Usually, polioencephalomalacia or polio. Sabi nila, pwede rin daw ang listeriosis or yung tinatawag na circling disease. Pwede rin daw yung ptosis, no? Or yung pregnancy toxemia. Ito yung mga nababasa natin na reports. So, what could be the other neurological cause? Sabi nila, syempre, yung vitamin A deficiency that could cause also blindness. So, yun, yung mga most common neurological causes of blindness. Ano naman siguro ninyo, vitamin A deficiency could really lead to blindness. Kaya nung bata tayo, pinapakain tayo ng kalabasa kasi pampalinaw daw ng mata yun. So, ganun din, no? So, pag may deficiency sa mga hayop, kakaroon din sila ng mga consequences like yung blindness nga po. And last one could be the anatomical problem or cause ng blindness or keratoconjunctivitis. Commonly, yung entropion. Ano ba yung entropion? Entropion is the abnormal folding inward of one or both eyelids. So, pumapasok siya dun sa loob. So, abnormality to and it can be congenital. Ibig sabihin, nung pinanganak, ganun na siya. When I was in college, naka-encounter ako ng ganito sa aso, yung chow-chow. So, we did a surgical correction of entropion. Ang gagawin mo lang doon, magbabawas ka ng skin and then you will make corrective surgery. No? Yes, it is effective. So, more likely ganun din sa goats. Bakit siya nagkakos ng keratoconjunctivitis? Kasi naiirita syempre yung cornea and conjunctiva ng eyes. Kaya siya nagkakaroon ng inflammation and reddening. So, these are the other causes of pink eye aside from the more common cause, which is the bacterial infection. So, ano yung common bacteria that cause pink eye? There are two reported causes. Well, first is the Chlamydia psittaci, which is the same organism that causes enzootic abortion in sheep. And also another cause is the Mycoplasma conjunctiviae. So far, dalawa yung reports na nagkakos ng pink eye sa ating mga alagang sheep and goats. Gusto mong malaman kung alin sa dalawa ang nag-cause, ay pwede kang mag-submit ng sample. Or your vet could take lab sample and this sample will be analyzed in the lab. Magkakaroon ng bacterial isolation para malaman kung ano yung naging cause. Kasi baka mamaya, ano pala siya, no? Siya yung nagkakos ng enzootic abortions, no? So, delikado yon. While waiting for the lab result, anong gagawin natin? So, we will give antibiotics. Okay, so that's a treatment of choice. May mga iba't-ibang produkto na available sa market, no, that you could use. But I would suggest that we use topical antibiotics. Okay, pwedeng ophthalmic cream, pwedeng drops. So, meron akong ginagamit na cream, no? It's like a cream paste. Para siyang paste, gano'n, nalagay sa mata. And there is a proper technique on how to do that, okay? Make sure that you are wearing gloves when you do this. Why? Because it is to prevent the spread of infection. So, in some cases, yung iba kasi masyado ng laborious or madami silang dapat bigyan. So, nagsisystemic antibiotics sila. But be very careful with systemic antibiotics, no? Especially with the long-acting ones. Kasi, mas mahaba yung withdrawal period, okay? As compared to topical na antibiotics, which does not go systemically. Kasi hindi naman nagkakaroon ng residue kapag topical. I mean, sa internal organs, unlike with systemic antibiotics. So, yon yung common na bacterial causes ng pink eye or keratoconjunctivitis. So, ano yung mga predisposing factors, no? Overcrowding. Usually yan, overcrowding, poor ventilation. Diyan nagsisimula yung pink eye. Yung isa lang na infected, ano siya ha? Nakakahawa. So, kapag may nakita ka ng isa, isolate na yan para hindi na mahawa yung iba. That's the first thing that you should do. You isolate. And then, assess, no, yung environment. Non-infectious kaya siya? Or do you think it is infectious? So, yun yung dalawang bagay na i-assess mo after you isolate the animal. So, is there a way to prevent it? Well, aside from the management, which is make sure that clean and safe yung environment for the animals, and also yung well-ventilated sila, and walang overcrowding. No? Yun yung mga bagay na i-assess mo. But, is there a vaccine? Sorry, wala pong vaccine, no? I mean, sa Pilipinas, wala pa ngayon. I think sa ibang bansa, mayroong vaccine, pink eye in cattle. But we cannot use that for our small ruminants. Why? Because the causative agent in cattle is Moraxella bovis. That is a different bacteria. So, hindi rin siya maging effective dun sa small ruminants natin kasi iba naman yung bacteria na nag-cause ng pink eye or keratoconjunctivitis. Ano yung pwede natin gawin? Preventive lang po talaga. So, management, no? Good management practices, good animal husbandry practices or GAHAP. So, make sure na walang overcrowding, malinis ang kapaligiran, hindi dusty, and make sure na walang grasses doon na allergic yung herd ninyo. And syempre, walang mga splinters or walang mga nakausli na nails, possibly cause trauma to your animal. Yun po, may mga available na sa market na mga gamot if it is infectious. So again, no, let me reiterate this. Make sure that when you use antibiotics, your vet prescribed it because it is a prescription drug. May nakalagay dyan, RX. Okay? And if you go systemically, make sure that you observe withdrawal period po. So, kung pink eye lang naman yan, or pwede naman tayong gumamit ng ophthalmic na solution, no? Could be cream, lotion, or drops. That would be better. Pero kasi, is it deadly? Most of the time, it's not deadly. Pero, malaki yung economic losses kasi nagkakaroon ng blindness. Siyempre, pag blindness, hindi makikita ng animal yung pagkain niya. So, you have to hand feed them and also give them their liquids. So, very laborious din sa mga tao. And at the same time, mahirapang lumaki yung alaga mo. Unlike the other animals, hindi siya nakakain as much as he or she wants kasi hindi nga niya makita yung pagkain because of the blindness. So, hindi naman siya nakakamatay, pero nakakamatay ng bulsa. Sana meron po kayo natutunan sa ating maikling kwentuhan with Doc Athena. Maraming salamat. Hanggang sa muli, and God bless us all. I hope to see you again soon. Bye!